Did you know that over 1 in 7 people globally suffer from a mental health disorder? Or that someone dies by suicide every 40 seconds? Mental health is a global crisis, and the numbers are staggering. But why is the world facing such a challenge, and what can we do to change it? In today's video, we're uncovering the latest global mental health statistics, the shocking disparities between countries, and most importantly, how we can tackle the mental health crisis together. Stay tuned to discover the trends, key issues, and innovative solutions making a difference worldwide. Mental health issues are affecting millions of people across every continent. From anxiety and depression to bipolar disorder and schizophrenia, no one is immune. But the reality is, the global mental health landscape isn't just about numbers, it's about people. Today, we'll break down the most up-to-date global statistics, highlighting the key trends, regional disparities, and the treatment gaps that are putting millions of lives at risk. We'll also dive deep into solutions from scaling up mental health care to using technology to make help more accessible. But first, let's start by understanding the scope of the problem. Let's start with the hard facts. Right now, more than 792 million people suffer from some form of mental health disorder. That's 1 in 7 people globally. Anxiety disorders top the list, affecting 284 million people worldwide, while depression is close behind, with 264 million individuals suffering globally. The numbers are even more concerning when you factor in the rising rates of mental health disorders among adolescents and young adults. According to UNICEF, 13% of adolescents worldwide are living with a mental health condition. With social media, academic pressures, and the challenges of adolescence itself, young people are more vulnerable than ever before. When it comes to the global suicide crisis, each year more than 700,000 people die by suicide. That's a staggering one person every 40 seconds. Suicide is the fourth leading cause of death among young people aged 15 to 29. In fact, many suicides are preventable, but the lack of adequate mental health care leaves many without the support they need. In high-income countries like the United States and Europe, mental health resources are more accessible, but the burden is still significant. However, in regions like Sub-Saharan Africa and South Asia, cultural stigma, lack of funding, and underdeveloped healthcare systems make it almost impossible for people to access mental health care. In low and middle income countries, up to 75% of people with mental health disorders receive no treatment at all. Mental health is not just a medical issue, it's an economic one too. The global economy loses an estimated $1 trillion annually due to lost productivity caused by depression and anxiety. Poor mental health doesn't just affect the individual, it impacts communities, workplaces, and economies worldwide. Then came the COVID-19 pandemic, a mental health catastrophe like no other. The pandemic led to a 25% increase in the prevalence of anxiety and depression globally. Social isolation, lockdowns, and the fear of the unknown triggered emotional and psychological struggles for millions. For healthcare workers on the front lines, the stress and burnout were severe. In countries that were hardest hit by the pandemic, healthcare workers reported higher levels of post-traumatic stress disorder, PTSD, and anxiety disorders. And it wasn't just those who got sick or were on the front lines. The ripple effects of grief, unemployment, financial insecurity, and loneliness have affected everyone. Lockdowns had a particularly devastating effect on children and adolescents. With schools closed, children lost not just their education, but the vital social networks that schools provide. Adolescents who already struggle with mental health issues experienced heightened levels of depression, anxiety, and loneliness. Screen time increased, with social media becoming a lifeline for connection, but it also contributed to the rise in cyberbullying and comparison anxiety. The COVID-19 pandemic also exposed major gaps in mental health care. Many countries were unprepared for the surge in mental health cases. Telehealth services, while a lifeline for some, were inaccessible to those without stable internet connections, particularly in low-income and rural areas. The mental health crisis caused by the pandemic will have long-lasting impacts, particularly for those who already face significant barriers to care. Now, let's talk about the treatment gap, the most significant issue we face in the global mental health crisis. The WHO estimates that more than 75% of people with mental health disorders in low and middle income countries receive no treatment at all. This number is shocking, especially when you consider the human toll that untreated mental illness can take. In sub-Saharan Africa, for example, there are fewer than one psychiatrist per 500,000 people. Compare that to high-income countries like the United States, where there are 70 mental health workers per 100,000 people. This discrepancy highlights how inequitable access to mental health care is across the world. Even in countries with a higher number of mental health professionals, wait times can be long, and many people struggle to afford treatment. In some parts of the world, particularly in rural and underserved areas, mental health services are almost non-existent. Mental health disorders are often dismissed or misunderstood. In many cultures, mental illness is stigmatized, seen as a personal failure rather than a medical condition. This stigma prevents millions of people from seeking help, even when treatment is available. The global mental health workforce is severely under-resourced. WHO data shows that the global average is 9 mental health workers per 100,000 people. In low-income countries, that number drops to less than 1 per 100,000. For every person struggling with a mental health disorder, there simply aren't enough professionals available to provide the care they need. But the treatment gap isn't just about the lack of mental health workers. It's also about the cost of care. In many countries, mental health services are expensive and not covered by public health insurance. People who can't afford out-of-pocket costs often go without treatment, exacerbating their conditions and leading to further social and economic difficulties. So, how do we tackle the global mental health crisis? The solution starts with closing the treatment gap and making mental health services more accessible to everyone, regardless of where they live. One promising approach is to integrate mental health services into primary care. This means training primary care providers to diagnose and treat common mental health conditions like depression and anxiety. By bringing mental health services to local clinics and hospitals, we can reduce the stigma and make it easier for people to get help. The WHO's Mental Health Gap Action Program, MHGAP, is one example of how we can achieve this. By providing tools and training to primary care workers in low and middle-income countries, MHGAP aims to expand access to mental health care in places where resources are scarce. Countries like Ethiopia and Uganda have already implemented the program with great success, bringing care to rural areas that were previously underserved. Another important solution is leveraging technology. The rise of teletherapy and mental health apps has revolutionized mental health care, particularly during the COVID-19 pandemic. Platforms like Talkspace and BetterHelp have made it easier than ever to access therapy from the comfort of your own home. In addition to teletherapy, apps like Headspace and Calm are helping millions of people manage stress, anxiety, and depression through mindfulness practices. For people who might not be ready for therapy, these apps provide an accessible first step toward improving their mental health. But to truly bridge the gap, we need to ensure that these digital tools are available in low and middle-income countries where the need is greatest. We also need to tackle the stigma surrounding mental health. Public awareness campaigns are key to breaking down cultural barriers that prevent people from seeking help. In countries like India and Brazil, community outreach programs are helping to normalize conversations around mental health. By engaging local leaders, healthcare providers, and influencers, these programs are changing the way mental illness is viewed. Schools and workplaces also play a crucial role in improving mental health. In recent years, mental health education programs have been introduced into schools in countries like Australia, the UK, and Finland. These programs help students learn about emotional well-being and coping strategies, reducing the stigma around seeking help. Workplaces, too, are starting to offer mental health support services, recognizing that a mentally healthy workforce is key to productivity and job satisfaction. Mental health is a global challenge that touches every one of us, but it's a challenge we can face together. Whether it's through improving access to care, leveraging technology, or breaking the stigma, change is possible. Now it's time for you to take action. If you or someone you know is struggling, don't wait to get help. And if you're passionate about mental health, consider becoming part of the solution by raising awareness, advocating for policy changes, or supporting mental health organizations. The mental health crisis is global, but together we can make a difference. One step, one person, one conversation at a time.